All right, welcome back. Our allergy series continues today with a revolutionary procedure that could cure your sinus pain. Dr. Anna Bouknight is here this morning to tell us about this. We've been doing these stories about allergies. There's so many people dealing with allergies, but
Yes.
you have an interesting device here. Tell us what this is.
This is the Intellis Express. It's actually one of several devices that allows us to perform a balloon dilation, which opens the natural openings to the sinus cavities without having to cut out bone or remove tissue.
Oh.
And we can now do this in the office.
Oh, okay. Would this be considered surgery, or?
It's sort of like a colonoscopy.
Okay.
It's really not surgery in
Okay.
terms of, especially when we do it in the office, there's no anesthesia, general anesthesia that's required.
Okay.
Although, of course, we numb up a patient, we get them nice and comfortable. But by doing this, we don't have to cut out bone or tissue, and so
Okay.
there's really very minimal bleeding.
Okay.
So it's more of a procedure rather than a surgical procedure.
Gotcha. So tell us how, what goes all into this process, and how long does it take?
Normally, the numbing process, start to finish, getting a patient in, getting them nice and comfortable, doing the procedure, and then letting them go home, takes roughly an hour.
Okay.
The procedure itself, depending on how many sinuses need to be addressed, can take anywhere from 10 minutes to 25 to 30 minutes.
Okay, so not too long.
It's not.
For something like that could help alleviate that pain that you have, that issue with those allergies. So how fairly new is this? Because not like I'm a medical expert or anything, but this is my first time hearing about this.
Actually, the FDA approved the first sinuplasty device in 2005.
Okay.
And it's only in the last decade that we've started to become more sophisticated in terms of the types of technology that's available, what we're able to do in the office. This device is very nice because it's streamlined.
Okay.
And it allows us to address these sinuses without a lot of discomfort to the patient. So in the last several years, our practice has been very proactive about trying to do these in the office so that patients don't have the downtime of the anesthesia. The recovery from this is very quick. It's a couple of days at the most.
Okay.
We ask patients to limit their activities for a few days, but other than that, they're back at work, back at school, doing carpool, things like that.
Now we're showing animated video of how the process works, and then there's something that goes along with this, is like a balloon. Can you explain that part of it?
Yes. This idea was actually stolen from the cardiologists. A lot of patients now are aware of how angioplasty can open up blood vessels. Well, we use a very similar technique in terms of using a wire to identify the natural opening to the different sinus cavities, and then a balloon is threaded over the wire, and that balloon is placed in the natural pathway where the sinuses drain. So the balloon is then inflated to a certain atmosphere that allows a dilation or an opening of that sinus pathway.
Wow, and helping people breathe, which
Absolutely.
So many of us who, if we don't have these issues, some of the little thing we take advantage of, there's the being able to breathe just every day.
Right, and it alleviates a lot of sinus congestion, a lot of sinus pain, and it really helps to open up the natural pathways and allow patients to just drain better so they don't have these barometric pressure changes in their sinuses.
Right, and that can happen at any moment.
Yes.
Thank you so much. This is a very interesting, fairly new technology that's helping people dealing with these allergies. Thank you so much for coming in so early to tell us about this.
Well, thank you for inviting me.